All right, let's get started. Welcome to tonight's webinar from Brown University School of Professional Studies. The mission of Brown University is to serve the community, the nation, and the world by discovering, communicating, and preserving knowledge and understanding in a spirit of free inquiry. The Master of Science in Healthcare Leadership at Brown School of Professional Studies is guided by that mission and seeks to develop healthcare leaders of the future. In the spirit of serving our communities, the nation, and the world, we're excited to continue our series titled Lessons in Leadership, Let's Talk Healthcare. These sessions are open to anyone who would like to join us, so please invite your colleagues and team members to future sessions. All of our future sessions are listed on our website. The format for tonight's session is for our panelists to present first, followed by an open discussion. You can put your questions in the Q&A tab at any time. Tonight's session is called Healthcare in the Digital Age, Opportunities and Challenges. So let's get to it. I'd like to introduce you to Dr. Banu Ozkazanc-Pan, our faculty expert for the evening. Banu is a professor of the practice at Brown School of Engineering and academic director of the I.E. Brown EMBA program. She's also the founder and director of the Venture Capital Inclusion Lab at the Nelson Center for Entrepreneurship here at Brown University. Our panelists tonight are Jason Card and Sam Holvey. Jason is a 2019 graduate of the MHL program and is an industrial and operations engineer by training. He spent several years at the Johns Hopkins University Applied Physics Lab and is currently the technical project manager for implementations at a digital healthcare startup called Transcarent. Sam Holvey is a 2017 graduate of the MHL program and a longtime employee and advocate at WEDI, the Workgroup for Electronic Data Interchange. Her current title is Director for Workgroups and Communications. With those introductions, I'll turn things over to Banu to kick us off. Thanks so much for joining us, Banu.
Thanks, Sandy. And I'm going to share my screen and get going on our slideshow for the evening. So what I'm going to do tonight is to give you a really broad overview of what we call the fourth industrial revolution, which is essentially saying we are in a new phase of technological change and discovery, and how can we think about the changes that are going to be happening in different industries based on these digital transformations that are going to come. So I'm going to spend about 15 minutes just kind of giving you the context of what's happening. First, talking about the future of work and digitization, which is a really hard word to say. And then we're going to move a little bit into what does this mean for healthcare settings specifically as our context, where experts Jason and Sam will speak a little bit later. So I'm going to start with very basic questions, which actually are not that easy to answer. And one, what is digital transformation? What's changing and how is it relevant for our workplaces, our organizations, and specifically the healthcare sector? And just to add on to Sandy's wonderful introduction for me, I ended up marrying into a family of different kinds of physicians. My husband is an anesthesiologist, so every day he comes home with what I call people and organizational problems that are related to, in many ways, some of the digital transformations that he's seeing, not only in the industry, but literally within his workplace in terms of how he can manage his workflow and engage with patients and other healthcare providers. So if you're familiar with the first industrial revolution, this is essentially a water and steam power to mechanized production. The second industrial revolution, we found electric power and created mass production. Third industrial revolution, we started getting into electronics and IT, information technology, to automate production. And now you'll probably hear this a lot. The fourth industrial revolution is essentially building on the third, and it's been called as the digital revolution. It's been something that's been going on for a bit, but what's really unique about this is that we're really deciding, or we're really seeing sort of the decisive fusion of technologies that's blurring the lines between the physical, the digital, and the biological spheres. And this is really new. And it raises all kinds of opportunities, but also all kinds of challenges. So when we see the fourth industrial revolution and the fusion of the physical, digital, and biological worlds, inevitably we're going to be impacting not only our lives, but very specific domains within our world. So policies, industries, societies, economies, how we think about global and local governance, but perhaps more fundamentally about how we think about humanity. And there's no better example than some of the sci-fi flicks that we see on TV that sort of give us a glimpse of this potential future where we have fused ourselves with machines and so forth to think about what's possible. This change really allows us to think about three really important parts that are going to be changing, and potentially why these changes are different in the ways that we've seen the revolutions in the first, second, and third industrial stages of human development a little bit differently. So what we're seeing is a very distinct way in which velocity, scope, and systems are getting impacted in ways that they haven't been before. And by that, I mean that the speed at which we're making discoveries has really no historical precedent, right? So these new technologies are sort of growing in exponential rather than linear ways. And what that means is that almost in every country, in every industry, we're seeing disruption happening. What this means for our organizations and workplaces and how we think about and organize work is we're likely going to see the transformation of entire systems of production, management, and governance. And by governance, I mean the rules of the game that sort of decide how we should assemble our societies and economies. At the one sort of very hopeful end, we can potentially say that this new fourth industrial revolution has the potential to raise everyone's income levels on a global scale and improve the quality of life for lots of different people around the world, particularly if we're coming to terms with the fact that we're creating and discovering new medicines, personalized medicines, new technological advancements that could really uplift many people's lives around the world and create all kinds of products and services. And there are great examples, and we'll get into some more specific to healthcare, but right now we are sort of doing all these things without really thinking about the technologies that allowed them to take place in the first place. You know, ordering an Uber, booking a flight, buying products, making payments, listening to music, all those things we're doing through some tech-enabled platform or app, and doing it remotely. So one of the most important technological innovations related to these changes are that supply side changes are going to be taking place, which we like to talk about in the world of business as being more efficient and productive. So these are, again, potential upsides. And we also assume that in some cases, there'll be some cost reductions, global supply chains hopefully will become more effective. The cost of trade will go down and new markets and opportunities for economic growth will happen. Now, in many cases, we see these things, but at the same time, we also see the dark side, which is we see that there is a huge and rising and persistent inequality that's embedded in the systems that we're a part of, and potentially the fourth industrial revolution is going to make things worse. We also know that the largest beneficiaries of innovation, so these new technological changes, tend to be those who are providing intellectual and physical capital. And those are your innovators, entrepreneurs, shareholders, and investors, which is creating an even bigger gap between those who are dependent on capital versus those who provide their labor. And what we are seeing right now is we're sort of seeing a stretching out of skills. So there's a higher demand for highly skilled workers, while the demand for workers with less education and lower skills seems to be decreasing. You'll see these conversations engaged in with talk about like how do you upskill people so that when and if automation comes, that they will still have an opportunity to be employed even if in another industry. So what we call that academically is there's a hollowing out of the middle class in America and in other places. And building on these changes has been sort of the incredibly awful effects of the pandemic, where some of these inequalities were incredibly stubborn and I would say sedimented in ways that potentially are not going to get better for a long time. So the pandemic really exemplifies sort of an external shock to a system that was already in the midst of growing inequalities. So depending on where you sit on the supply side, you might see that there are new and exciting ways of serving the needs of customers or consumers and existing industry value chains that have been there since the beginning. It can also mean that there is no innovative competitors, which I think, Sam and Jason are going to be talking about, sort of these new digital business models and new opportunities that are coming in to the healthcare sector, potentially improving quality, speed, or price. And at the same time, we're seeing major shifts on the demand side, and the demand side really is us, right? Consumers, they're demanding more transparency, they're much more engaged, and we're seeing that their behaviors, because they have access to different data and networks, is potentially forcing companies to really think about what they're designing, what the market outreach looks like, and how they deliver products and services. So again, consumers are finding that they actually have some input into making an impact on business. Getting to the end, I promise. One of the most interesting and I would say, areas to create businesses has come is in the form of platform companies or platforms that combine both demand and supply. So there's sort of a match, right? You match a service or match a product. And these technology platforms really allow us to use our phones, our smartphones, to assemble different people, assets, and data and create essentially whole new ways of consuming goods and services. And what we're seeing is there's this proliferation of these platform-enabled businesses across all industries, including in healthcare. So there's four main areas that the Industrial Revolution, the fourth kind, is going to have, and they really hone in on customer expectations, product enhancement, how we think about innovation in a collaborative fashion, and how organizations are changing literally how they're structured and formed, right? So in many ways, we're seeing that digital capabilities are enhancing existing physical products and services, potentially offering a better value for consumers. And we're also seeing that sometimes technologies can make assets more durable and resilient. And everyone in all industries is talking about the value and ways data and data analytics can be leveraged to understand trends, but also to create better products and services. So at the end of the day, we have the emergence of these global platforms and new business models that maybe force us to rethink how we get the best talent, how we create organizational culture, and how we maybe form organizations that are organized differently, given that technology enables us to work in ways that we haven't been able to before. We all know that there are certain technologies that are incredibly mainstreamed right now, including automation, drone, and AI. And all of these are also within the healthcare context being used. You might say, how is drone being used? But vaccine delivery in certain parts of the world was through drones during the height of the pandemic. And you're seeing that the adoption of these technologies is dramatically changing how we organize our work and organize our societies. Some provocations to think about throughout the night is, what does this mean at the end of the day? Are we really changing the kind of jobs that people will have? What does that mean for how we think about creating jobs and opportunities for people? And how do we think about making sure that the inequalities that are already in the system are not exacerbated? And that kind of brings us to tonight's talk, which is, well, we're going to talk about all these issues in the US healthcare context, which, and I kind of pulled out some bits and pieces here, is one, heavily regulated. It's an industry where change at times can be quite slow and bureaucratic. If you're in a hospital system, you're familiar with the fact that there are occupational hierarchies and tensions between medical doctors, nurses, and all kinds of different staff in terms of who's considered an expert, the role that administrators play, and staff. And all of this impacts not only healthcare costs, but delivery. There are huge ethical considerations around the ways in which we deliver medicine, and the ways in which privacy concerns are now at the forefront, with the fact that data is somewhat of a commodity these days, right? And it seems that what is considered legal medical practice seems to be changing, particularly in the US. And quite, persistently, inequalities are a large part of the ways in which the US has seen and continues to see inequalities take shape within the US healthcare system. I'm sure there's others that I am forgetting or haven't touched upon, but I want to leave you with this sense that there are a lot of things happening with the fourth industrial revolution that are impacting consumers, customers, products, the ways in which we innovate, and the ways in which we organize our work, particularly in the shape and form of healthcare and healthcare delivery services. So with that, I will stop sharing and I will pass it on to Jason, who will speak about his expertise and experiences, given he is he's doing all this right now.
Thank you, Banu, and for that excellent context. I think it really helps start off the conversation. And thank you, Sandy and Brown, for inviting me to participate on this panel. It's definitely an honor to be here as a graduate of the Master of Healthcare Leadership program here at Brown. I come from a technical background of engineering and analytics, and I mentioned that up front because I want to come back to a comparison of what my technical peers who chose other industries have experienced from a digital revolution perspective compared to what I've experienced and what we've all experienced in the healthcare industry. So currently, I'm one of about 250 employees at Transcarent, a new kind of health and healthcare company. I work as a technical project manager on the client implementations team. And the topic for this panel really hits quite close to home for us because Transcarent is taking the opportunities presented by the digital age to build the kind of healthcare system that we want to experience as Americans. So before diving into our specific digital experience as a solution, I wanted to talk about what is the problem with the status quo that we're trying to address. The American health system is quite confusing, complex, and costly. It's getting worse each year. Health equality is getting worse. We've seen some digitization in our industry. We've had electronic health records, we've had patient portals, we've had a plethora of point solutions. And COVID showed us that when we needed to, a lot of healthcare could be delivered virtually at a national scale. But at an industry level, all that has changed is now patients and employers have more accounts and more logins to manage. There hasn't been any way for an individual to guarantee themselves quality, cost-effective, or timely care. And the idea of making the care experience pleasant for that individual is not even part of the conversation that typically happens. And I'm probably preaching to the choir with some of these statements. Everyone who's attending this panel is already at the upper level of understanding the US healthcare system and its limitations. And yet even we as kind of those experts in the field must pause when we face our own health challenges in our personal lives. How confident are we that we could point a friend to best-in-class care for surgery or oncology? How confident are we that we're getting the best prices on prescriptions? Could we be seen by a top specialist if we needed one for a critical need that developed? And if the answer was no, or even a hesitant decision on any of these questions, let's think about why that is. And what I've witnessed in the healthcare industry in particular is a lot of smart and talented individuals just accept this status quo when it comes to healthcare, that nothing's going to substantially change, that the healthcare system is broken, and that without sweeping changes enacted at the federal government level, there's not going to be a major difference made. And yet we as consumers don't accept this in any other industry. And we don't really think of ourselves as consumers all the time when it comes to healthcare, but perhaps adapting that mindset could help us get out of the habit of accepting subpar experiences in this industry. And if we think about most other industries, they already have at least one household name which completely revolutionized the consumer experience. If we think about what Google did for information, what Amazon did for shopping, and what Uber did for transportation, They all followed some very similar patterns in what they offered to consumers compared to what was offered previously. In a nutshell, consumers can now access affordable, high quality, all-in-one experiences on their terms, meaning whenever and however they want to access those experiences in every industry in this country now, except for healthcare. So what we said at Transcarent is that we don't need to just accept the current state, and that the digital age presented us with a new opportunity to create that healthcare system that we wanted, because we ourselves are healthcare consumers deeply unsatisfied with the status quo in this country. So to summarize, what we've come up with is we're a new type of company that has created a carefully selected, unified health and healthcare solution that comes together to meet 90% of your healthcare needs in one place. Employers offer the Transcarent experience to their employees and their families who enroll in their health plan. And going back to those patterns that we've seen revolutionizing other industries during the digital age, we're focused on hitting on each of those points that I mentioned. So consumers want an all-in-one experience that's accessible on their terms. So we've made our experience accessible the same way that individuals call an Uber, through the Transcarent app that's available and useful to consumers 24/7. So with one login as a Transcarent member, I can address most of my health and healthcare needs, from the full spectrum, from wellness to everyday care to complex care. With just one tap, I can be in front of a doctor virtually for urgent care needs in under a minute. I can schedule an appointment with a high quality primary care doctor in my area. I can ensure that my prescriptions are coming from the most affordable option available to me. And for my biggest healthcare decisions, such as oncology or surgery, I can make sure that I'm getting that care from a top of the line center of excellence. And if there isn't one available to me locally, I can use Transcarent to help me with setting up travel to get to one. With health being so important compared to other industries, we felt that there needed to be a human touch associated with this whole experience. It couldn't just be automated robocalls when members had issues come up with their health. So our members have access to health guides who can help them with questions all along the way throughout their health and healthcare journeys. These health guides form a continuity with the members that they work with over time and become a real trusted part of their health team. And then the two other parts of the expectations that we all have for digital experiences outside of healthcare are cost and quality. So those are intertwined and core to the experience that we created. We know that getting the right care from the right provider at the right time will ultimately result in better quality and lower costs. So we created what I think of as a win-win-win scenario that gets the member to high quality care, cost-effective care, and with the savings created shared between the employer and Transcarent. So we're so confident that our experience will deliver in our results that we offer a full risk structure to employers who sign up for Transcarent, so that we get paid when we deliver on our objective of delivering quality, cost-effective care. And the results have been dramatic in the way that we were hoping for. From a quality perspective, we've seen all the right reductions in readmissions, unnecessary urgent care, unnecessary ER visits, unnecessary surgeries, and complications. From a cost perspective, we've seen a reduction in the total cost of care per person per year. And tying it all together, we've had improved member satisfaction with members who are genuinely excited to talk about their health and healthcare experiences with Transcarent. And so before I hand it off to Sam, I wanted to share a quick video that our wonderful communications team put together to hopefully reinforce what I've talked about so far. And then after the video, Sam can take it away. So give me 1 second to share. Hey.
Hi, I'm Anna, a health guide with Transcarent. We're here to bring transparency, simplicity, and more humanity to health and care. Transcarent is the best way to access your healthcare. A simple experience designed around you, with access to a doctor in 60 seconds, 24/7, or help scheduling a visit with a local, high-quality provider. You can consult with expert providers on your treatment plans and even receive personalized support for your surgical journey. You and your loved ones deserve a better way to get healthcare. Here's how it works. Access your care the same way you'd text a friend, book a ride, or stream a movie from the palm of your hand. No hassles, no surprises, and a whole lot more affordable. Everything from a cold to knee surgery. You can expect the best possible outcome without a bunch of surprise bills. I know, this sounds too good to be true, but it's actually pretty simple. Transcarent's pre-negotiated rates save your health plan money, and that savings is passed on to you. When you're proactive about your health, everyone benefits. It's easy to get started. Just download the app, register your free account, and start saving time, energy, and money. Welcome to your new and better health and care experience.
Thank you very much. On to Sam.
Wow, thank you, Jason. That was very interesting. Little background on me. So I graduated from the Masters in Healthcare Leadership way back when it was the Executive Masters in Healthcare Leadership in 2017. And I've actually been with WEDI, the Workgroup for Electronic Data Interchange, since 2012. So I've been here for a decade. We are an official advisor to the Secretary of Health and Human Services. We're a national member association, not for profit. So I'm not here to sell you anything, but hopefully you take away some nuggets and some new information. So basically, I'm just going to give you a high-level overview of a few things that came to mind whenever Sandy reached out to me to talk on this webinar with y'all today. And keep in mind that WEDI has been around since 1991, the same year that the internet was formed. So we have quite a span of topics that we've worked on and technology. And so seeing all of this change in the last 10 years has been amazing, but I feel like it's really ramped up within the last 3 to 4 years. And I expect that to continue, mostly because of different policies that are being worked on and being actually enacted right now. So the latest policies that are advancing healthcare that should be reflected in digital health. We've got the No Surprises Act. We'll be seeing a huge move towards price transparency, especially in telehealth and virtual provider services. And I think Transcarent just gave you a sneak peek of what's to come for a lot of services like that. And services like Amazon Clinic and Mark Cuban's Cost Plus Drugs pharmacies are actually subverting the typical system by excluding health insurance altogether, which is why it's easier for them to post prices. And Apple is actually expecting to launch health insurance in 2024, building on health data that they have from iWatches. So I'm hoping that it's like the State Farm insurance where you get lower premiums for healthier lifestyles. So like I'll just spend more time on the treadmill and it'll decrease my health insurance costs. That's what I'm hoping for. Okay, an increase in ransomware and digital insecurity. It's a huge problem for health systems, especially in this financial climate. The HHS just released their latest press release on cybersecurity and ransomware threats. It's really bad right now. And the Cybersecurity Infrastructure and Security Agency recently requested industry feedback on their cyber incident reporting for Critical Infrastructure Act of 2022. So expect that to be finalized in 2023. The current administration, presidential administration, has made health equity a priority. So from HHS, the Centers for, Digital Health is very much alphabet soup. So we have HHS, CMS, ONC, all the government agencies are making health equity a big priority. and you can see how so many more digital tools are in the market space, and digital tools like natural language processing. So that's the assistance that doctors can use to take notes for them while they're talking to a patient, and also digital patient intake forms. So that is whether you're filling out these forms before you get to the doctor's office, or on a tablet at the doctor's office, or patient portal. Those are the digital intake forms, as opposed to writing on a clipboard, which I don't know about y'all, but I hate clipboards. And these tools can help catch social risks and improve social determinants of health. And there's actually been a study on people just figured, well, let's just use community data to catch social risk. So if you live in this particular area, this zip code, let's flag that person. And actually 40% of patients that would have some type of social risk would be completely missed. And 54% of people that have been flagged for social risk the resources would not be used efficiently. So we really need to make sure that we're getting the individual patient data and not just relying on community data. And a big thing, we actually did a podcast about this a few weeks ago. It's healthcare in the metaverse, which sounds really cool, right? Meanwhile, we still can't solve interoperability. And just a little deep dive into why we can't solve interoperability. So that's why, like, if you go to one hospital, another hospital can't get access to your records, it's a hot mess. And it's really, in my opinion, my very honest, and this is not Weedy's opinion, this is Sam Holvey's opinion. My honest opinion is it's just the battle of the standards. So FHIR and EDI are the two big standards for exchanging information in healthcare. So EDI, electronic data interchange, standards from X12, which is a standard setting organization in healthcare, have been widely used for data modeling and communication purposes within healthcare for decades, like 40 years. But now the new advanced data, fast healthcare interoperability resources, FHIR, F-H-I-R, which as a marketing communications person, I love an acronym that I can use for marketing. But it was developed by HL7, another standard setting organization, and it's gained a huge adoption rate among the tech savvy healthcare companies because FHIR data payloads can be more flexible since they're based on API resources rather than full EDI documents that X12 uses. And FHIR is the future is kind of what is being marketed. But what I'm hearing from a lot of folks at our conferences, just small talk, is that people are timid about using it because it hasn't been fully proven in the same way that X12 transactions have. And the information blocking regulations finalized in early 2020 require providers, health information exchanges, and health IT developers certified by the ONC to widely share data with patients and each other. So if you follow me on LinkedIn or Twitter, you will have seen the free data by Nicolas Cage GIF. And that was in October. It was a big thing in the health IT world about the data is free. And then we had a conference and we had a lot of patient advocates there, and they were like, we don't know what to do with this data. This is too much data. We don't want to handle it. So I think that there's an interesting, the nexus between patients that want all of their data and patients that are so overwhelmed by their chronic condition that they cannot handle all of the data. And we need to make sure that we're serving both of those audiences. Meanwhile, the American Hospital Association sent a letter to HHS saying that providers weren't ready to share the data. And a big reason why providers say they weren't ready to share the data is because technical infrastructure wasn't there. Interoperability is not there right now. So a bright spot in all of this, artificial intelligence, AI, is advancing rapidly in healthcare. more health systems are partnering with data analytic companies so they can improve patient outcomes with better treatments and population health predictions. And genomic testing and information integration has drastically improved just within the last few years. Seeing genetic information being integrated into decision-making tools is super interesting and very exciting, but the industry needs standards for coding and exchanging this genomic information and coding genomic testing, so that way hospitals can get paid from health plans for doing the genomic testing. So that was just a brief overview of a lot of things going on. Apologies for the fire hose of information, but if you want more information on any of that or anything else going on in the health IT, especially when it comes to standards and regulations, feel free to reach out to me, and I'll put my email address in the chat.
Thank you so much to all of you. You all gave some really great background in terms of, I think what Banu said is sort of this acceleration in the scope and detail of what's happening so quickly. Sam, can you comment a little bit more on interoperability? I know, physicians in particular struggle with interoperability in terms of, particularly let's say in a primary care office, in terms of understanding what happened in that urgent care visit, what happened in that telehealth visit, what happened in the surgical consultation, and like that's the medical record systems, if you will, where we're storing all this information, don't talk to each other well.
No, they do not. And right now, what passes for some organization is interoperability is like, I'm going to send you the PDF of all of this patient's medical records, and you can't like do anything with it, but you can look at it and read it and then copy and paste that information into your system, which it's 2022. Like, we can do better. The technology is so much better, but and again, this is Sam Holvey, this is not Weedy. We live in a capitalist country, and we have already clearly made a decision that some people are going to make a lot of money off of other people being sick. And so we have very large EHR vendors that do not want to give up any market control. And so that's why, like, if Epic wanted there to be interoperability, it would be done like in a few weeks. So the big guys, they don't want to give up any of their market share, and the easier you make it to get information out of them, then the easier you could switch to another platform. And it's interesting, I actually recently went back to a hospital that I had been at, and this is a hospital that I had been a patient at 5 years ago, and now they switched to a new EHR system, and they didn't have my records. They were asking me because they couldn't find it in the EHR system, and I was just like, you've got to be kidding me. So I would love to see true interoperability happen within the next 4 to 5 years, but it's such a tough nut to crack because so much money is involved.
Yeah, for sure. I invite people to put their questions in the Q&A. In the meantime, I have a question for Jason. Transcarent sounds tremendous, and I'm sure there's a lot of detail involved in sort of how the whole model works. But one thing that struck me when you were presenting was what happens to this model when sort of the real physical world of delivery of healthcare is in an overwhelmed state, like in COVID, like the situation we are having with RSV, where providers, in mental health crisis, we have part of the RSV problem is that pediatric hospital beds are being taken up by mental health patients. So how do those two worlds collide, and how does a company like Transcarent try to manage through that?
It's a great question, and I think it can't solve all the disruptions, or it's not going to create suddenly new hospital beds, but what it can offer, I think, is a variety of different pathways for individuals to receive care, whether it's through virtual, through self guided tool sets, through different options that are not typically available, to just add to that kind of tool set available to consumers as healthcare consumers. And so when I see, for example, that the local urgent care has a 6-hour wait time to get in, I'm going to turn to the Transcarent app and get seen virtually within a minute and get that taken care of that way. So that's an example that I see in my personal experience with using the app there.
Right. Do you think that it has the possibility to kind of reduce some of that pressure in those urgent and emergent care settings, in terms of giving people an alternative to be evaluated to really determine if they need to get emergent service?
Yeah, I think so. And I think that's what we've started to see in the results playing out just that way, which is exactly what we hoped for. We've seen that reduction in people going to urgent care when they don't need to, going to ERs when they don't need to, getting people to the right type of care at the right time, and doing kind of whatever initial triage on the app side can really help with alleviating some of those delays that we really see in the healthcare system.
Awesome, thank you. So we have a question from a fellow alum, Jay Flanagan, who was a cohort 1 student in the program. He says, great presentation and thank you. You've done a great job describing organizational, institutional, and structural challenges to this issue. How much of a factor is patient or consumer reluctance in this transformation? People who are unused to technology or mistrustful or whatever, is there patient or consumer resistance a real roadblock, or do we think that people are going to go along with it when all the big pieces get put together?
Just from the weedy side, I can say that there will always be minor roadblocks, and one size doesn't fit all for everybody, but that's not a reason you shouldn't work on advancing healthcare. And something that I might want and I might use, my grandma might not want or use, and something she wants and uses, I'm not going to want and use. So I think that just because one piece of the population doesn't want to participate doesn't mean that it should slow things down for everybody.
That's an interesting point. And do you think the sort of technology platforms can adapt to those varying consumer use profiles?
Yeah, I mean, my grandma texts me every morning, and 10 years ago, I would have been shocked if you told me that my grandma knew how to use her iPhone. She knows how to use Facebook. So I think that we're really limiting people that don't need to be limited by assuming that they wouldn't want to use this type of technology. So I think a lot of people would be surprised. And whereas my dad, he has a much bigger problem with his healthcare data security than he does with making sure that he gets quick care or, best access to care. He's very concerned about the security of his data. Whereas I am in a generation, I'm an elder millennial, and I know that everybody already has my data. We gave Russia our data back when we had the opportunity to see what we'd look like as old people on Facebook. So we've already given out our data. Security isn't as big of a concern for younger generations as for older generations, but one size doesn't have to fit all.
I would agree for sure on the Transcarent side. It's not one size fits all. There is the opportunity to use kind of more traditional like phone call based connections, or visit using a laptop or a tablet, if not trying to use the smartphone to connect. But there is certainly kind of a ubiquity and growing more each year of apps and of society kind of accepting that as the status quo. And I think we've seen, and certainly I can agree with this, there are individuals that have a reluctance to engage with the traditional US healthcare system, and are finding it to be easier to engage with Transcarent, where I don't have to sign up for an in-person appointment. I can actually just check out the app, read a little bit more. Maybe I've been thinking about getting a primary care appointment, but I don't know where to start. I thinking about behavioral health, which a lot of people have a very difficult time opening up about. Having that kind of self-service starting point and then transitioning to a virtual point, it really lowers that barrier of entry for a lot of people to getting into the health and healthcare system that exists.
Can I add to that? I saw in the pandemic that the growth of telehealth was actually quite positive for many people. And in some cases that has continued, in other cases it has not. I think sometimes insurance pays for it, sometimes it does not. And the other area where there's some research, which is really interesting, kind of goes to Jay's question, is there is user reluctance. Sometimes it's generational, but sometimes it has to do with the nature of what is happening to the patient and whether they want a person or whether they want that information conveyed to them in a manner that'll allow them to digest it, maybe in the privacy of their own home. So sometimes we'll see that if it's going to be really bad news, they really want a human sort of sharing that with them and to have that empathy. But for other people, they want that bad news on their phone and they want to process it as, in the comfort and privacy of their own home. So I think what that engagement is maybe makes a difference for whether or not the user wants, in this case, the patient wants a person versus they want to engage through a digital, platform. It's fascinating.
Okay, we have a question from Ian Segal, who asks, why can't healthcare systems model themselves after a bolstered supply chain management system that applies trending, forecasting, and thresholds for managing the demand for patient care and the demand in hospitals, urgent care, and other similar facilities? He says, I've done this successfully in manufacturing, warehousing, and fulfillment for pharmaceuticals.
I can take a first stab at that, actually. So we're getting closer. I forget off the top of my head, I want to say Kaiser and Mercy are joining together. Two very large health systems with very different patient populations are joining together and using an advanced analytical programming company to help with that exact thing, so they can better gauge their population health to know when, a new like crush of flu or like the current like RSV crazy incidents that are going on right now. So that way they'll be able to know when those things are going to happen. So they'll be stocked up on the appropriate medicines and workers and all of the resources that they need. So we're getting there, but everything in healthcare moves so slow. It's very frustrating. But we are, I feel like that is like a next future wave of healthcare.
Yes, we had a student who was in West Virginia during COVID, who his critical challenge project really was around using flu data and analytics around people who had received flu shots and where the best pockets of immunization were to predict where urgent and emergent services are going to be needed and required based on immunization status of the population. So really some fascinating opportunity out there to start to do the kinds of things that Ian is asking about. So Jason, did you have something you want to add?
I think just kind of similar. There are definitely those pockets, like some of those examples both of you mentioned, where this is being done. It just hasn't been adapted at kind of any kind of more national scale, where it can be seen more widely. But I think reading about industrial engineering and healthcare, those are some of those skill sets that have taken the manufacturing lessons learned and tried to apply it to healthcare with some interesting results. But it's really limited to kind of use cases and examples rather than the standard expectation at this point.
Right, we have a ways to go or opportunities. Robin Cody, who's one of our current students, is asking, Jason, is Transcarent Access a benefit that employers purchase? Can individuals subscribe? Do you partner with commercial insurance? Does it factor a consumer's insurance network into recommendations for providers? She's got more here. Do you contract with providers who provide virtual care? I'm impressed and intrigued by the complexity of what you're achieving.
Yeah, quite a few questions. I'll try to make sure I hit on at least most of them. We partner with employers, are essentially our clients. So it's something that the employer would have to agree with to make it available to the employees and family members of their health plan. That's kind of how the entire model is based off of.
So does that mean if like many employers say offer a plan choice, does that mean your platform can manage the networks of, let's say, 2 different insurance plans that their employees are enrolled in?
Yeah, it's a big part of our implementations and all of our agreements that we have to make to get it all working is understanding who's involved in what plan. And I know that was one of the other questions that was asked is does it take into account the network when making the recommendations? Absolutely. We want to make sure that we're not sending you to care somewhere that you're going to get a surprise bill at the end. That would be the exact opposite of what we're trying to achieve. So we definitely have to have those partnerships with the insurers to understand who is and isn't in network when we make our recommendations.
And a part of what she asked was in terms of, you've referenced a number of times sort of access to a clinician in a minute. And are you contracting with a care company that provides you that instant access, and how are you managing that?
Yeah, we partner with a variety of different clinical partners to achieve kind of each of the different examples that we're providing. And then our goal is to make it a unified solution that all on the member end doesn't have to look like it's one solution or the other. It's all just kind of through that Transcarent app and through that one experience.
Great. There's one more question here, which is from Dr. Pito, your quality improvement faculty. And he asks if Jason is using his own company for his own healthcare needs. And if so, what do you find that's working and what needs to be improved?
Yeah, great question. We definitely use it. We call it Transcarent for Transcarent. All of our employees and family members who are on our health plan have access to Transcarent. And it definitely is something that I'm really excited to have access to. It makes it, I think, so much more enjoyable to go through the implementations with new clients, knowing myself, how beneficial it's been. It just makes me, all that more excited to get those new members access to the tool. I found, probably the best thing for me, and I don't know, the only negative would be tied to this and my own personality, is kind of being in that youngish man demographic. I'm in that reluctance to use healthcare traditionally point, and Transcarent definitely kind of removes all those barriers. So that's been an adjustment for me, is finally getting those checkups that I should have always been doing. Is now there's there's no excuse like there was with past plans. It's so easy. I can just open the app and press a button. So that's an adjustment for me, but I it's got to be a good thing.
Right. In the long run, that's a good thing for your health and
Mhm.
your health and wellness. All right. Well, we're just at about time, and I want to thank all three of you and our guests who participated in the conversation. This has been a really great dialogue on how digitization, as Banu said, was really hard to pronounce, is really shaping and impacting the healthcare delivery and market and segments all across healthcare. And I look forward to continuing these conversations with all of you in the future. So please be on the lookout. We'll return to our lessons in leadership sessions in the new year. So I look forward to seeing everyone then. Thanks so much for participating tonight, everyone. Have a good night.
Thanks, Sandy.
Thank you.